Just in relation to clinical negligence, you were saying that in 2010 the figure was 81 million. I think you said earlier on.
That's right.
Yeah. So the projected figure this year or even next year could be 6 times that amount. If I'm reading this right, it could be
nearly 6 times this year.
Up to €500 million.
It'll be over €500 million.
That's absolutely incredible.
Yeah.
What's kind of, I suppose, pushing this? What's why is it incrementally going up by that amount? It's an amazing amount of money in relation to just negligence. And I know things happen in health services, but this is an incredible figure, really.
It is. Deputy, to your first point, 126,000 staff have been paid. 126,000 staff have been paid. And if I may just respectfully disagree with you on the wording that you used. I mean, would everyone, all of us, prefer that it had all been paid within the first week of the government decision? Of course we would, right? The HSE has been dealing with a lot, in fairness. And the other thing is that the financial management systems, it goes back to the chair's point in terms of the e-infrastructure. They are being improved. The HSE was nervous, and I think legitimately nervous, of whilst it paid its own staff, and it paid a lot of its own staff reasonably quickly. Again, we all would have preferred it to be quicker, but reasonably quickly. They were genuinely nervous that if they started sending out monies to private for-profit companies, right? So the home support, the carers going out, they're private for-profit, the nursing homes, they're private for-profit companies. The HSE was genuinely concerned that if they sent out the wrong amounts, if they sent out too much, that they'd be hauled in here into before PAC, for example, potentially here, and they'd be criticised for, not taking care of public money enough. And I have some sympathy with that. However, because it was taking so long to put what they believed the sufficient safeguards in place for the public monies were, as I was saying earlier on, I intervened and said, I want a different process, which is send out a self-assessment, let the private companies and the Section 39s do a self-assessment, and then pay the money and audit it afterwards. And that was a compromise, essentially, to get the monies paid. But I think it is relevant that 126,000 staff have been paid. Of course, we want them all paid, but I do think that is relevant as well. When it comes to the State's Claims Agency and medical negligence, this is a real issue. It's an issue for many reasons. I'm sure members of the committee, I'm sure yourself, you've spoken to clinicians who now talk of practicing defensive medicine. Over-referring, overuse of diagnostics, because in certain specialties they are scared of spending all of their time in court. In some areas, I know they're finding it hard to hire people in because so much of their time ends up getting spent in the High Court or preparing for the High Court, and that's not why they became healthcare professionals. It is an issue. And as you quite rightly say, a jump from 80 million or 81 million in 2010 to an estimated 530 million this year, an estimated higher next year, is something that I believe we have to take a fundamentally new approach to and be very strategic about identifying where the patient safety issues are occurring. First and foremost, stopping them, because that matters far more than any payouts from the SCA, is patients, is minimising and eliminating harm to patients. And then we need to have, I believe, mechanisms available to patients that are not in the courts. Now, it turns out that 98% of clinical negligence cases handled by the State's Claims Agency are resolved without court hearing. So 98% do get resolved. But nonetheless, I believe there are mechanisms like no-fault compensation schemes which are used in other countries which we need to look at. You'll be familiar with Judge Meenan's report. A lot of recommendations in there. And the latest advice I have is that good progress is being made on those recommendations. I believe there's more to be done.
Just, Minister, just in relation to the clinical negligence, I mean, one could draw from that either people are taking more kind of litigation against the health service, or there's an issue with, you know, I mean, the figures are unbelievable, really. But obviously, is it a situation where doctors and medical professionals are so under pressure in relation to resources, they are kind of making more mistakes? I mean, we understand this happen, like mistakes happen in health services, but there has to be a reason why all this is happening. That's incrementally, over the last decade, it's gone shot from 80 million to 530 million. There has to be a reason.
My view is there are many reasons. What we need is we need the data, we need the research, we need the cold hard information to say what exactly is driving all of these things in different ways, and then we need a plan which we'll be looking to put together to deal with this.
Because obviously it's a lot of money that could be better spent elsewhere in the health service. Obviously,
it's a lot of money, Deputy, and it's a lot of patient harm.
Yeah,
that's my biggest concern. Of course, we have to be cognizant of the money, but ultimately, all of this money is simply reflecting harm to patients. And that's what we've got to be ruthless in identifying and eliminating.
Yeah. Just in relation to the pandemic recognition payment. So you're saying 126,000 people have been paid the payment. So how much of the 189 million has been spent? And
well, I'm going to hazard it'll be about 100. If we assume it's broadly 1,000 each. Some people are getting a bit less than that.
Yeah.
But it would be broadly around 126 million.
Right. So there's 60 million left. Do you know what percentage of Section 39 and those that are working in the private sector still haven't received the pandemic payment?
I'll get you those figures. We're getting updates on a weekly basis now from the HSE, and I'll send the committee around a note afterwards. But there is a large volume of the private organisations in the Section 39s are now returning these forms. And what I've asked the HSE to do, and my understanding is they are doing it, is very, very quickly turning that around into the payments. I want, and what I said to the HSE is, anyone who has submitted within a reasonable time before Christmas, they need to be paid for all the reasons we understand.
But you can understand why people that were working in the height of the pandemic in the private sector or in a nursing home could be really peed off in relation to this. Like the goodwill that was, as I said, welcomed last January, they still haven't been paid.
Of course, and none of us want to be here. But no. Can I just, though, I think, can we just take a step back for a moment, right? So first of all, let's acknowledge that these payments should have happened earlier this year. Let's absolutely acknowledge that. And let's acknowledge that there are still, unfortunately, whilst, 126,000, and, it'll be more by the end of the week, have been paid. There are tens of thousands who haven't been paid. So let's just start by acknowledging that. But also, let's just reflect, this is, one of the things that I was determined, and government was determined, that this would be a genuine recognition and that it would be good by international comparisons. And it is. And would I prefer that they had the €1,000 in June than in December? Yes. But it is still good that it's €1,000 being paid. And critically, and credit to Pascal Donoghue, I asked the Minister if we could make it tax-free. And very, very little gets made tax-free, let me tell you. And to Minister Donoghue's credit, he agreed. I said, we cannot give people €1,000 and then take 500 back, or more than 500 back in tax, right? But normally that's what it would happen. So whilst can I accept that we would have all liked it to be earlier, there's still about €190 million in tax-free money being paid out to about 190,000 men and women in our system, and ultimately I think that is a good thing.
No, it's a very good thing. It's just the way it was kind of delivered.
Yeah,
quite. I mean, we all I think agree that it was just people not getting it for a period of up to a year. It just takes the kind of goodwill out of it.
Well, it won't be up to a year, though. To be clear, the decision was only made earlier this year. And the vast majority of these should be paid before Christmas. So it's still within the same year.
Yeah, hopefully it's obviously...
But yes, I wish it had all happened in the first number of months, as do we all.
Okay, thanks.
Minister.